All right, well, welcome to Community Conversations here at Atlantic Health System. Today's episode is called Returning to a New Normal. My name is Luke Margolis. I'm the Corporate Communications Director here at Atlantic Health, and I am excited to be joined today by our President and CEO, Brian Gragnolati. Brian, thanks for coming in again.
Thanks, Luke.
So we're going to give about a minute or two for folks to join into the room, if you will, onto our live stream here. And while we do that, I'll just remind some of our folks that you can watch this live as we are presenting it now. The entire video will live on our Facebook page in its entirety, so you can go back and watch it again there if you missed any portion of it, or if you want to share a link with friends. And then finally, this will also be available on News 12 Plus. So if you have cable or Fios and you want to watch it on that channel there, you can certainly check your local listings and see the episodes there in their entirety as well. So again, we are just about ready to get started. Today's conversation, which is following up on some successful conversations we've had recently with other Atlantic Health System leaders, is called Returning to a New Normal. And Brian, I think as we take a look at where we're going with this pandemic, and folks are considering about how they can get their lives back to something that resembles normal, you and I had a conversation about what that term, a new normal, looks like. So if we can, let's have you start there, and then we'll dive into some details as we move through our conversation. So what is a new normal in your perspective as we go through this pandemic?
You know, I get asked that question all the time, and I'm convinced a new normal is recognizing that we're going to coexist with COVID. And we're going to be in that situation for the next couple of years. Okay. And I know that's a tough thing to say, and people will point to, oh, there's a vaccine that was just announced this weekend, or there's a new treatment that might occur. And I pray to God that that's the case, but from where I sit right now in terms of caring for communities and having an organization like Atlantic, we have to plan for a new normal, which is coexisting with COVID.
And that seems to permeate everything we do. Obviously, it'll mean coexisting both in terms of how we deliver care, but then in how people live their everyday lives, right? Because I guess let me back it up. What will be the solution to no longer having to coexist with COVID? Is it as simple as just having a vaccine? Is it that black and white?
You know, unfortunately it is. It's as black and white as simply having a vaccine, and then second, having people take the vaccine.
Right.
Making sure that it's obviously useful. The other thing is to have treatments available. You know, there's a lot of things that we've been experimenting with and trying to work on this, and oftentimes we've had some results with dealing with the symptoms, but not this silver bullet antiviral drug. And so those two things, not having a confident treatment that we can turn to and not having a vaccine available, really means that life as we used to know it is going to have to change. But it doesn't mean that that's necessarily a horrible thing.
Right. As we begin to look ahead, I think it's really valuable to talk about the things that we've done that work that could be incorporated into that future state. So if you can, let's take a look at what has really been successful for us, both in society with some of the public health things we've been doing, and here at Atlantic over the last few months that you think could be part of where we go moving forward. What has worked for us here?
Yeah, let me parse that into two concepts. One is, what have we done to try to decrease the spread? Because if you remember, you know, back when we were looking at the early charts, particularly about the impact in this greater New York area, we were seeing numbers that would have completely overrun the healthcare system. And the only tool that we had at our hands was social distancing and putting those kinds of severe restrictions on movement and businesses being open. And lo and behold, the predictive models of dealing with it in that way had us be able to thread a needle. In other words, we didn't overrun the healthcare system, we were able to care for patients when they needed it, but we had some scary times.
Sure.
We had some very scary times. So, one of the things that we learned is to listen to the science and to make sure that we follow that guidance, because it does really work. Here at Atlantic, we learned a lot of important lessons, and one of them is that our strategy works either during periods of normal types of illness or disease, and also in a pandemic. And again, when I say that, people say, really? And I say, yeah, because if you think about it, here at Atlantic, we are laser focused on clinical excellence and access to care. And that worked during the pandemic. I am just so proud of our team here at Atlantic and the flexibility that they had to really focus in on how can we provide great access to care, not just for COVID patients, but also for other patients that had other illnesses, and we'll talk about that in a minute. But at the same time, how do we recognize that we got something that we really don't completely understand? And we're gonna have to mobilize all of our talent to try to figure out what we're learning as we go along. And we've seen some incredible innovations that occurred during that period of time. Whether it was the initial response of, we need to intubate patients quickly, because that's going to give them the best result, to then learning that maybe if we delay that a little bit, try some other techniques, change the physical positions of patients.
Proning, I think I've heard that referred to as.
That we'll get a result that might be a little better. And so we saw that adaptation. The same thing when you're doubling or tripling or quadrupling your capacity of intensive care beds. You just don't have the number of team members who have that expert training in that to be able to scale that up. It's just not available. And so again, because of the flexibility of our team members, we had nurses from a number of other areas who were willing to come in, work under the guidance of an expert clinician in a pod, and lo and behold, that provided just excellent and outstanding care.
But is that maintainable long-term, right? I mean, because I think if the goal is to say that we are going to be coexisting with COVID for an extended period of time, are those setups the types of things that we can say, all right, it worked then, we'll position it so that we can continue to work now? How are we positioning our system to be able to respond later this year if need be?
So the first thing that we're doing to try to position our system to respond is to do things that make sure we never get there again at that level. Because make no mistake, the numbers that we saw here at one point at our peak were almost 900 patients in the hospital.
On any given day.
On any given day. And we may have had 30% of them in intensive care units and a majority of them on ventilators. We don't want to be there again. That's why following the rules of reopening, the social distancing, making sure that people are washing their hands and wearing their masks like we are, those are all going to be critically important, because we want to tamp down that level of activity so that we have COVID patients that we're caring for, and we're doing that safely, and we're doing it in ways that protect the other patients and our team members. But at the same time, we need to hedge that bet and know that if we do see that surge, we've got to be able to, again, move care out of the hospital and delay it like we're doing now, and we'll talk about that, so that we can surge up again. But I hope we're never there, but we have to be ready.
With that in mind then, what are the most important things that need to happen from your perspective to prevent us from reaching that spot? Because, I know there's no way to predict for sure where we'll see another surge in this, but there are things we can do to mitigate. So what are some of those things in your mind?
So when I talk to groups of elected officials, they always say, well, what can we do to help?
All right, sure.
And what I talk about is what could happen this fall or this winter. So if you think about it, we've got a normal flu season that often taxes the resources of the healthcare system. We also have a patient population in our community that doesn't necessarily get immunized at the levels that are helpful.
To the flu, getting their flu
Yeah.
shot.
You know, our teammates here at Atlantic, because we want to protect any patient that comes here, all get vaccinated.
That's right.
It's a mandatory requirement that we have to work here. And if you can't get vaccinated, we make sure that there's protections that you have to abide by to not transmit the flu. Well, we've got to get those levels way up there of immunization because we want to tamp down the flu this coming winter.
Amongst the population, the
Amongst
general
the population. We've got to do that. So that's one thing that we can do, and that's in our control. That is absolutely in our control. The second thing that we've noticed during this pandemic is that people have taken literally stay at home. Now, when the governor said stay at home, he didn't say stay at home even if you're having a heart attack, or stay at home even if you're having a stroke. But unfortunately, people have stayed away from the healthcare system in ways that are unhealthy, putting off chronic care visits and things like that. And we see it evidenced not just in the severity of illness we're seeing in our EDs right now or in our offices, but unfortunately in our pre-hospital services, our paramedics have been called to many homes to pronounce people dead at a rate that's twice what is typical. So we need to also make sure people are going to get the care that they need, get in the system now, it's available, it's safe, and do that. Because if we do those two things that we can control, get your vaccinations for the flu, take care of your care needs now, in the event that we do see surges occur or hot spots occur, and we can do the kind of testing we need to determine exactly where they are and then do the contact tracing that we can do, we can keep the COVID population down. But if we don't do those things, if people ignore the guidance on what they need to do, because this will pass, I don't believe this is going to happen, or if we don't have the testing in place and the ability to do contact tracing and then begin to make sure that people are isolated in a proper way, we're going to see another surge, and that would be a very scary thing.
I want to pick up on I think everybody pretty much has a grasp on the flu shots and where they can go about getting that. But I want to touch a little more strongly on availing themselves of receiving care, because I know Governor Murphy towards the end of last week talked about the resumption of, and the health commissioner talked about it as well, the resumption of what they called elective procedures. And there are many people, to your point, who would love to go about getting some of these things done. But I guess we are still awaiting some guidance, some public guidance from the administration about what that would look like. So while we are taping this on a day where it may come out between now and when this runs again, just know that as of our taping now, that guidance has not been released publicly. But I'm curious, how important, in your opinion, is it that we begin to resume that work? And what does it look like at Atlantic Health System when we're able to start doing some of those elective procedures?
Sure. So I have the opportunity to sit on a professional advisory committee that is advising the governor about these matters. And there will be guidance moving forward, hopefully this week, that begins to describe how we're going to reopen what is described as elective surgery, but it really is a little more than that. And that's a good thing, because it'll give people confidence that it's time to enter back into the healthcare system. But the thing that I think people miss here is that our hospitals and our doctors' offices and our ambulatory sites here at Atlantic before COVID were very safe. During the surge, they were also very safe, because we had deliberate things that we did to make sure that we kept our team members safe and our patients safe. And I think when the data begin to emerge, you'll see more evidence of that, but clearly that was the case. And we're safe now. because as we have brought our activities down, because our activities from the peak are down by about 2/3. And so at our peak, we were a little less than 900 patients in the hospital per day, as I said earlier. I think today we're a little over 200 in all of our hospitals.
Spread throughout the whole
Spread
system.
through all of our hospitals.
Right.
And so that's a good thing. And we now are seeing our census increase, and we've put in so many additional safety measures on top of what was already very safe. Things like checklists and special attention to social distancing.
Right.
You may go to your doctor's office now after a telehealth visit, and they might want to see you in the office, and maybe you'll have to wait in your car instead of the waiting room, if we know that that waiting room doesn't have the requisite space. That's the level of detail that we're working on. The same thing with air handling and cleaning filters and using technology to disinfect rooms and making sure that we're not crossing pathways between patients who have COVID and patients who do not. So we're doing all of those kinds of things. So moving forward, it's important to know that we're open for business. This executive order will clarify that we're ready to do more surgeries and more procedures. So if you've been delaying things, you'll be able to come in here, and we're really looking forward to getting that guidance out as soon as possible.
There has been lately some conversation. I know NJHA recently put out a release about this, about the finances of the healthcare industry, and specifically here in New Jersey. And so, just to give folks a sense of that and the importance that moving forward on these procedures presents to us. From a timing perspective, is this the right time to begin to do a lot of this stuff? Not just from the clinical side of it and the need that we know, but this is an important step for health systems as well, isn't it?
Yeah. This pandemic has dramatically impacted our hospitals and health systems and doctors' practices throughout the country in a pretty dramatic way. Because if you think about it, these rules that were put in place to really close down non-emergency care, they were the right thing to do, because that created the capacity that allowed us to deal with this surge of patients that we saw. And as I said, here at Atlantic, we threaded that needle, and I'm very proud of what we did. But moving that kind of activity out, things like heart surgeries that were not emergent, or a lot of orthopedic procedures, or other types of things that needed to be done but could wait, has impacted our level of activity and our revenue by about 40%. So our revenues have been off for the last 2.5 months by 40%.
Which illustrates why that support from the federal government and others is so important.
Yeah, and then the second piece is, the things that we had to do to make sure we could surge capacity, create all these intensive care units, bring in a lot of extra team members. We had pay programs that addressed the needs that we have at that time, and PPE were all incredibly expensive. And the reimbursement that we received for taking care of these very critically ill patients nowhere near came close to what the true cost of that care is. So you put those two things together, where you've had a loss of about 40% of your revenue, and at the same time you have really increased your expenses dramatically, has affected us financially. Now, fortunately, we had three things going for us. One is that, here at Atlantic, one is that we went into this in a very strong and conservative financial position. We have been able to navigate these changes in a pretty good way, and that has allowed us to not affect people's jobs, which was one of our important goals and continues to be an important goal. The second thing is that early on, we availed ourselves of one of the federal programs that allowed revenue to come in early. Now that's set up as a loan, but it gives you cash flow during that period of time. And then the third thing is that under the CARES Act, grants have been made. Now the first tranche of those grants went distributed to all hospitals throughout the country. The second tranche has been focused in the surge areas, and we were very fortunate to receive those funds. And we are looking forward to and expecting more of those payments over the next couple of weeks. The goal of the federal program was to do two things: recognize the added expense associated with COVID, but also recognize the loss of revenue. They're never going to equal out, but they've been a big help.
You mentioned PPE. How important is the continued pursuit of it? Because I think there's probably this perception that, you know, that we're through the worst of it, and so as such, the need has probably abated a little bit.
So I'm on another, one of the governor's councils on reopening the economy, a more general one, and this morning I was asked to comment on that. The two problems that linger in the healthcare system today are availability of diagnostic testing at the bedside whenever you want it, or at the exam room side, or at the curbside.
And diagnostic is, do you have it at that point in time?
Do you have COVID at that point? Mm-hmm. And that is going to continue to need to be pursued, because we don't have a definitive plan to do the broad scale testing we need to do. The governor's working really hard on it, and I'm confident that we will find a pathway there, but there's a lot of demand on that right now. The second is around PPE, because as the economy opens, consumers are going to want to be protected from those who are helping them, whether
Sure.
it's restaurant workers or people in retail. So masks, gloves, are going to be really important, and there's a big push on them right now. And again, this is happening throughout the world.
Right, so think about every restaurant that wants to reopen, how they need to equip their teams.
And then the second thing are, a lot of the surgery centers and the physicians' offices, they need to be resupplied with protective equipment in order to make sure that their team members are protected and their patients are protected. Again, a lot of pressure on that. And, to be quite honest, we have seen some ugly business practices out there on the supply chain. And so what we're doing here at Atlantic is we are actively creating our own stockpiles. This notion of just-in-time delivery from a supply chain standpoint does not work in a pandemic.
No.
So we've rented more warehouse space, we're out in the market, we're working with Barnabas and Hackensack and St. Joe's and other partners we have to do joint purchasing, we're going to continue to make sure we've got the right supplies, but we're going to need the government's help there. We've got to make sure that the government stockpiles are filled up. We've got to make sure that the kind of things that were done with masks, with Ford Motor Company and ventilators, will produce the other things we need, like gowns and gloves and masks.
As we talk about returning to a new normal and looking ahead, we've just got a couple of minutes left. Do we have a role to play as a healthcare system in terms of setting an example, right? Through the ways that we prepare our team members to do their jobs safely, the types of social distancing things we have in place here. Do you hope that Atlantic Health System plays a role as a bit of a role model for other businesses who may be looking to reopen as well?
I think our team members are the heroes. And they've done extraordinary things to care for our communities. And because of that, I think we take this virus very, very seriously, because we see the consequences of it. Mm-hmm. I think the farther away you are from that direct connection, particularly if you're in other parts of the country where it hasn't really hit and it's not in your line of sight, and you're watching whatever media you choose to watch, you're either going to think that this doesn't exist and it's not going to affect me, or you're going to, I think, feel like us, who have been in this hot spot that it is all around us. And we have to be just hyper vigilant. I'm not sure that either extreme is right, because you can't live life in a bubble, but you can sure live life smarter by washing your hands, masking, following principles of social distancing. And what I'd encourage everyone in the healthcare field to do is to share your stories with your community. Make this real for people so that they understand that, number one, this has not gone away, and number two, it may not have affected you or a family member yet, but if it does, it might be pretty bad. And don't let that happen. And the more stories we can get out, not to scare people, but just to bring to life the impact that this has had. And I think that healthcare professionals who have been involved in this are the best advocates for that, because when we do all the research about trust, nurses, doctors, respiratory therapists, pharmacists, they're all at the top of the list in a whole bunch of other categories that I didn't mention, and now people will be upset. They're at the top.
We got a limited amount of time.
They're at the top of the list, and people trust them, particularly doctors and nurses. And so I think that the more we can advocate for this, the better.
Thank you, Brian. I appreciate you taking some time today. We are just about out of time. I know there may have been some pixelation in the video there that we're hearing from some of the comments in the thread. We are recording this as well, like I said, so the entire thing will be visible both on our Facebook page and on News 12 as well. So in addition, we are having our audio copies shared on our SoundCloud account. So if you use that for podcasting or things along those lines and want to follow along in an audio version, you can get that as well. So, Brian, we are just about out of time here. I want to thank you for taking a second to chat with us today. I think as we enter this new normal, there's a lot of anxiety, and rightfully so for a lot of people, but information seems to be the key to resolving some of that anxiety.
You know, and while there's anxiety, there should be a lot of hope, because out of bad things always comes a lot of good. Sure. And I think we need to just think about the new normal being a new good. And you know, the outpouring of the community, the way we've all worked together, and the innovation I've seen coming out of this pandemic has been incredible. So while it's scary and it's been difficult, I'm very optimistic about the future.
Brian, thank you so much.
Thank you.
All right, folks, thank you so much for tuning in, and we'll see you next time here on Community Conversations here at Atlantic Health System.